Hi, I'm Dr. David Purves. Have you heard the saying that if you give a man a fish, he eats for a day, and if you teach him to fish, he feeds himself for the rest of his life? Well, of course, knowledge is the key. You teach a man to fish, you give him the knowledge which enables him to manage the quality of his life every day of his life. Well, I'm not a fisherman, I'm a psychologist, although I am quite next to a fishing lake here in Canada. But in my years of psychological research, I've come to realize that knowledge is the key which enables people to take themselves out of many of the common psychological problems that exist, such as depression, anxiety and stress. Historically, it's been the case that we rely on medical professionals to treat us. So if you're depressed or anxious, you go to the doctor and they give you an antidepressant, and pretty much that's it. You just take it for 6 months, a year, 2 years, 3 years, however long. And I've known people taking antidepressants for 15 years. Commonly, I've seen these in my practice. Well, in my research, I've demonstrated without question that people are better able to treat themselves, to manage their problems, to take themselves out of a clinical diagnosis, in a sense to be cured. They're much better able to do that than you might think. I have worked with many, probably thousands by now, people that have used remote systems, computer-based cognitive behaviour therapy systems, to treat themselves without ever seeing a therapist. Now, knowledge is the key. In my research on how to help people to move out of a clinical diagnosis of one sort or another, but principally anxiety and depression, I've developed what I call the 3 N's of active self-help. And I think these principles, these 3 N's, are kind of key. And if they're satisfied, then I don't see any obvious reason why someone would remain in a clinical diagnosis. Now, for some people it's going to be a bit harder, and for some people it's going to be a bit easier. But it's not about the severity of depression and anxiety, it's more about application and effort. Let me tell you what these 3 N's are. The first N is you need to know what the problem is. Well, people would say, well, I'm depressed, that's the problem. And I'm going to say, no, that's not the problem, that's a consequence of the problem. The problem is going to be something else, such as you've stopped doing things that give you pleasure, you've stopped mixing with people, you've stopped engaging in social events, you're applying strict and critical rules, you're underestimating yourself, you're overestimating problems that you might have experienced in life. I mean, a whole host of psychological things. These cause depression. Depression, therefore, is a symptom of these other things. So then the second N is we need to know what to do about it. So we need to know what to do about managing these things which have caused depression, changing these things which have caused depression. Typically, a psychotherapy of some sort has been the obvious choice. These days, it's typically cognitive behaviour therapy. CBT is a great roadmap for accessing the things which cause depression and anxiety and changing them so that they no longer exert that influence, depressing mood or creating fear-inducing emotions. The third then is how to do it. Now, typically a psychotherapist or a psychologist of some sort would say, well, this is what you do and this is how you do it. And the client would then take that away and they apply it to their lives. They come and say, yes, that works, that doesn't work quite so well. And it gets modified. But even then I found that if you knew how to do it yourself, if you've been shown, demonstrated, given the information, the knowledge, then you're perfectly able of applying the necessary tools and techniques to your life. You don't need someone, a face-to-face person, to kind of tell you what to do, to show you how to do it. So, for that reason, I've taken all of the knowledge that I have about psychotherapy and cognitive behaviour therapy, and I've crafted a cognitive behaviour therapy CBT solution, which gives you the 3 N's of active self-help in your life, which will enable you to go from where you are to where you want to get to with respect to mood and psychological well-being, and of course quality of life. Now, Mood Control is a 12-week cognitive behaviour therapy coaching course. Every week you get a new session of Mood Control released to you, and it has about an hour's worth of video and other kinds of materials that I've created. This is me kind of pouring my knowledge base out onto video to enable you to access and use the 3 N's of active self-help. Now, I want to make this kind of really accessible because this is the culmination so far of my career in creating computer-based cognitive behaviour therapy interventions. I want to make this so that you can use this, check it out for yourself, and get the benefits of CBT into your life. So there's a 30-day money-back guarantee. Use mood control for the first 30 days, which is going to give you 4 sessions actually. And if it's not for you, then just send me an email to the Mood Control help, and you'll find it inside Mood Control, and I'll refund your fee without any problem at all, no questions asked. Give yourself an opportunity, therefore, to try this and to see if it will change your life. The quality of your life is so important that you can't really afford not to take an opportunity like this to change the quality of life, to enhance it, to get more years of life, to feel better about the years that you've got. So, Mood Control will give you the opportunity to get CBT into your life no matter where you live and no matter what your circumstances. You can use these tools and techniques to better manage the quality of your journey. And I think that's a real benefit. So please, press the button below, join Mood Control. I hope to see you on the inside. You'll see plenty of me on the inside of Mood Control when you get there. Let me know how you get on. There's plenty of places to leave comments, and I want to know how you find the journey within Mood Control. Thanks for taking the time to watch and listen, and I hope to see you on the inside. Let's change the quality of the experience and have a better journey.